Welcome to the WOCNCB Certification Inspiration Podcast. My name is Lisa Obradovic, Marketing Manager for WOCNCB. In this episode, we are highlighting our 2024 Employer Recognition Award winner, NCH Healthcare System, based in Florida. Today, we are joined by several members of the NCH Healthcare System. We have Gina Teegarden, Chief Nursing Executive of NCH, and we also have members of the WOC Nurse team, who are all WOCNCB Certified nurses. Ursula Andrus, Debra Percher, Selma Musha, and Jaime Pinnock. I also wanted to introduce members of our award committee, Sarah, Alex, and Linda. All are members of the WOCNCB Board of Directors and are all WOCNCB certified nurses. They reviewed all the award submission nominations and will be leading the discussion today. Welcome everyone, and thank you for taking the time to speak with us. Sarah, you have a question regarding the start of the WOC program at NCH. Why don't you get the conversation started?
All right. Thank you all for being here with us. My first question for you is, how did the WOC nursing program start at your organization, and what was the growth process like for anybody who might have participated in any part of that?
This is Debbie. I can answer that. I came into the department about 11 years ago. At that time, there was a coordinator position, and there were 2 WOC nurse positions, and it has since then grown to a director position with 4 WOC nurses. And Gina, correct me if I'm wrong, but I think it's a 714-bed hospital.
Yes.
And it is, yes, is that right?
Yes, you're right.
And it's on 2 campuses, so we're spread out.
Great, thank you. How does your organization promote WOC nursing from within or recruit other nurses to the specialty since you've grown so much?
Hi, this is Selma. I'm going to answer that. So we partner with the administrators and collaborate so that they understand how our experience, expertise, and certification helps enhance patient care and improve the outcomes of the patient care.
Have you had any struggles with any partnerships with your units? I'm just wondering what the dynamic is like between unit staff, unit leaders, and your team of WOC nurses.
So our team of WOC nurses are fully integrated within the Department of Nursing. So the director of the department participates in all of our departmental meetings with other nursing leaders. So again, considered part of the team. We train some of our new nurses, our new to practice nurses, with our wound care specialist. And again, there's a comfort level with our team because they see these team members so frequently on the unit, and they've really just integrated to be part of the Department of Nursing.
Awesome. So one big team, but with a wound-specific director. That
Yes.
sounds great.
Absolutely.
So then to the WOC nurses who are on the call, what role have you played in continuing to foster those relationships, and how do you do that in your day-to-day with the floor nursing staff and with your leaders?
This is Selma again. So we work closely with the multidisciplinary team of physicians, nursing staff, respiratory therapists, dietitians, physical and occupational therapists to provide evidence-based patient-centered care. It's a very close relationship, aiming towards all the best outcomes for the patient being here at NCH.
Thank you.
You're welcome.
This is Linda. You won the most recent WOCNCB Employer Award. This is a huge honor. What advice would you give to another facility or nurse who is considering nominating their employer? And this is open to anybody that wants to chime in.
Great. Well, I'll kick it off. My advice to anyone that's thinking about nominating their employer, obviously continue to advocate for your team, advocate for certification, Professional practice is very important to our organization. We recently become, within the past month, Pathway to Excellence organization, accredited by the ANCC. So really focusing on those items that promote our profession and collaboration and growth is important. So again, just continuing to advocate.
All right, we'll move on to the next question. And this one is directed to all of you. So everybody has to answer this. If you could describe your WOCNCB team of nurses in one word, what would that be?
This is Jaime speaking, and I would definitely say invaluable.
This is Debbie speaking, and I would say excellent.
This is Selma. I would say the specialists.
And this is Ursula, and I would say team-driven.
And hi, it's Gina. I agree with everything everyone said, and I would add resourceful. I've seen this team go to great lengths to make sure that the patients get what they need, from the hours that they work to the type of treatment that they do. They really give them their all to make sure that our patients and their families receive what they need.
Great, thanks. And then again, this is directed to all of you. What inspired you to pursue WOCNCB certification?
This is Debbie. Although it was required for the job, I realized that having my certification would definitely provide a level of expertise that would be recognized by our patients, our families, the nursing staff, and the physicians, and all the ancillary staff.
This is Ursula. I have to agree with Debbie 100%. As a nurse for 20 years, wound care has been my specialty, if you will, for most of those years. But adding that certification just brought about, I would say, a higher level and confidence to overall patient care.
This is Jaime speaking. I've always been fortunate to work with a good team of WOCN nurses from the beginning of my career. So I was inspired by them to pursue certification in this particular specialty, and chosen the WOCN path versus others.
Okay, that's it for me. I'm going to let Alex take over.
Thank you, Linda. This is Alex. As Lisa has mentioned, I'm one of the board of directors, and we are with the nomination committee for the WOCNCB. I must say that as we were reviewing this year's applicants, what really stood out on your entry was the presence of a WOCNCB certified nurse manager or director who is actually leading and managing your WOC nursing team. And I say that's really one of the strengths of your nomination. So my question now would be, and anyone can answer this, anyone from the team, what is the impact of a WOCNCB certified nurse managed WOC nursing team on the organization and also among WOC nurses?
Pick it up. This is Gina. I think it was important for us to establish the director role. They are in a unique place that they can advocate for their team, advocate for their patients. Margie, our director, is always staying up to date on any new evidence. So really having that leader that can fulfill that role to bring that information to the team, advocate for the team, and really establish the program. Our wound care nurses are extremely busy. We're a large hospital, but Margie really helps with planning that strategy for, if we need to expand services, and kind of guide the ship that way.
I can add to that. This is Debbie. As a team, we are definitely very proud of the work that we accomplish on a daily basis, providing many patients with the care they need to enjoy healthy outcomes. I know our efforts are valued and they're appreciated when I walk into a patient's room, and I'm sure all of us experience this, and the nurse in the room will actually say, "Oh, here's the expert." Here comes the expert, and makes us feel good. Or the patient frequently will say, "Oh, the nurse or the physician spoke so highly of you." So we know that the word is out that, you know, we do excellent care, and we're happy to do it.
And this is Jaime, and I'd like to add for the outpatient department, being able to collaborate with the inpatient nurses, especially in the ostomy care department, for those patients that come out and need help outside. So that's been a really good program that they've set up for those patients.
Thank you. These are great answers, and thank you for highlighting the value of a director leadership role that is also WOCNCB certified. And I agree with you all. It does make an impact when a WOCNCB certified nurse has a seat on the leadership table, not only in hospitals, but across facilities. I'm going to go to my next question. And again, anyone from the team can answer this. How can organizations and employers best support the value of WOCNCB certified nurses?
This is Selma. So I think with the NCH, just by recruiting and retaining the best, by offering higher salaries, incentives, so we are very proud and very happy to work for our system.
And this is Gina. We also really try to encourage attendance at conferences, national conferences, anything that's going to, you know, promote their knowledge base, their well-being. And the director of the department, Margie, actually attended the Magnet conference with us this past year and is planning to go this upcoming year, really bringing her team into just nursing excellence at NCH.
That's really great to hear, and especially involvement with Magnet, coming from a Magnet institution myself. It's really important, right? My last question would be: how can WOCNCB certified nurses best advocate for their roles to achieve optimal organizational support? Probably anyone from the WOC nurse team can answer this.
This is Debbie. I think our tremendous productivity does speak for itself. Our patient visits are, of course, quantified, and we do bill for our visits. So we do contribute to the hospital's earnings. We have a strong pressure injury prevention program, which of course benefits our patients, but it also saves the hospital money, as we know. And beyond the positive financial impact, as a team, we do provide exceptional quality care to our patients.
And this is Jaime speaking for the outpatient. We definitely, exceed standards when it comes to providing care for our patients in the outpatient department.
And then I can just finish it up with the resource that they provide for the organization is so valuable. From, changing whatever wound care supplies that we have to keep up with the evidence to, really keeping track of mattresses. When were they bought? How old are they? We need to replace them, when Margie, brings something forward from her team, I recognize that it's something that we need. So there's a lot of trust with the department and really advocating for what our patients and our staff need.
Thank you for these great answers and for really highlighting the impact of WOCNCB nurses, not only at the local level, but more importantly at the systems level. And from frontline staff to the leadership table, like how WOCNCB nurses are involved, it truly is like a great nomination and deserving of the Employer Award. Thank you.
Thank you so much, and congratulations, everyone.
Thank you.
Thank you.
Thank you. Thank you.
To learn more about the Employer Recognition Award and the NCH, visit our website, WOCNCB.org, and select the Get Involved tab. Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.